What do we know about that in terms of the virus's ability to infect children? We know children can be infected. What does the disease that is caused in children? And we know for the most part, luckily, most children who are infected will have a mild disease and recover just fine, but that is not universal. We do know that there are some children that could develop severe disease, and some children, unfortunately, have died. And we do know that children can transmit this virus. We're still learning about this. We're still learning the extent of transmission among children of different age groups. And so that is a large unknown that we have right now. Some countries never closed their schools. Some countries have and are now opening up their schools. We are seeing some transmission that is happening in schools, and we're learning about this. What we've done is we've tried to offer some considerations for those taking decisions about when schools can be open. You have to remember that schools aren't in isolation. Schools are within communities. And if the virus is transmitting in the community, then the virus can transmit in that school. It's not only the children that we are concerned about, it's the people who work at those schools. So if the virus is present in the community, we need to really focus on driving down transmission in the community and to think about opening up the schools. We also need to consider how these schools are run in terms of the number of children per class, and if there are physical distancing that can take place, if there's hand hygiene available and running water and being able to wash hands. We need to look at the control measures that are in place that can be put in place in schools and the ability of those schools to rapidly be able to detect cases. But it's something that we're still learning about. And we need to make sure, I think the big thing is that if the virus is circulating in the communities, those schools are part of that community, and that means that the virus can enter the school as well. But we're still learning quite a lot about this. So we've outlined considerations. We've published those guidelines. We have established a technical advisory group that's working with us to look at educational institutions across the globe, because many schools look differently and operate differently across the globe, to look at our guidance and to look at the experiences of countries to see how we can further support decision makers in taking decisions about schools.
And Dr. Van Kerkhove, while I have you, let me ask you about the notion of further lockdowns, of border restrictions. Are we seeing any of those being effective, and that it might be necessary in some cases to impose more?
So that's a good question as well. I think when people use the word lockdown, that means different things to different groups. Many people we don't actually use that word lockdown because it's actually composed of several different types of interventions that are used. There are restrictions, stay-at-home restrictions that some countries have used. There are movement restrictions that some countries have used, physical distancing, hand hygiene, the whole package. And I think what the Director General has said and what we've tried to say from the beginning is that it isn't one action. It's actions of individuals, it's actions of communities, and we do see that these measures work. What we are seeing is that what we're hopeful for is that we will not have to, or countries will not have to impose any of these so-called large lockdown measures again. That actions can be tailored and they can be geographically limited to where you have the most intense transmission. They can be time limited to help countries activate their public health systems to find cases, isolate cases, care for cases, carry out contact tracing, make sure that testing is available, and make sure that communities are engaged, empowered, listened to, and are part of this fight.
Dr. Tedros, in your opening remarks, you mentioned that the Americas seem to be struggling the most right now, although obviously the entire world is affected. Can you offer your opinion as to why the Americas are having such a difficult time?
Okay. So my colleague who will take this.
First of all, let us take our hat off to all the frontline public workers, the frontline workers in the United States and all over the world who've worked so hard and risked their lives, left their families to look after, to save lives, to stop transmission. We are all in this together, and there are heroes in every corner of this, of the United States and around the world. Every country at this point has struggled at different parts and different stages in this pandemic response. No one has had all the right answers, and no one has done all the right things every time. This is a new virus evolving quickly. There are lots of unknowns. And referring maybe back to Maria's previous answer, I think the lockdown issue is a hugely blunt instrument. It's a very blunt measure. It suppresses the virus by really separating everybody from everybody else. And that's been the struggle. Can we move away from such a blunt measure to a more sophisticated, real-time, localized, targeted, comprehensive strategy based on local data, local action, rapid turnaround of testing, the ability to isolate and treat cases quickly, the ability to identify, track, trace, and quarantine contacts. In other words, if we are to get out of this, and I would say this to the United States, as I would say to many other countries, we have to create a new partnership, a new deal between government services and community action. Communities, individuals have to be empowered, educated, they have to want to participate. They have to take most of the actions needed in terms of physical distancing, wearing masks, hand hygiene, avoiding crowded places. But they need to be facilitated and supported in that if they have to go into quarantine, if they have to be isolated. And the local authorities need the data, they need the rapid turnaround of testing, they need to be able to do case finding, contact tracing, we need a massive ramp up of the public health workforce in order to do that. This has to be a major push, and we all have to take a breath now. We all have to stand back. And it's very easy to look from one side of this house to the other, one side of this world to the other, and point at what everyone else is not doing right. What we all need to do collectively, we need to take a step back, we need to look at the problem again, and we need to go at the problem again. And that needs everybody on board. It means bipartisan, all of government, all states, all communities working together. And that requires strong, sustained, and trusted leadership at all levels to make that happen. This is not easy. It's easy to say. It's not easy to deliver. We have the tools to suppress and bring this disease under control, and we hope we will have the tools to eliminate this disease as a public health threat when vaccines come along. In the meantime, as the DG said and has said again and again, do it all.